Hello YouTube, welcome to Dr. Vibes, a learning point. In this video we will study about surgical site infections. So first of all, there are 4 classes of wounds that you know, and this has been discussed in the video previously. So if it is a class 1 wound, then the infection rate after prophylaxis is 1 to 2%, and the infection rate without prophylaxis is also 1 to 2%. But as the class of the wound progresses, then you can see that there is a difference in the infection rate with and without prophylaxis. For example, class 2 wound, the infection rate with prophylaxis is 3%, and without prophylaxis it is more, that is 6 to 9%. So we can say that class 2 wounds can benefit from prophylaxis. And in class 3 and 4 we have prophylactic antibiotics as well. Now come to the surgical site infection proper. So what is SSI? Either incisional or organ space infection occurring within 30 days after surgery or within 1 year. If an implant is present, then we call it as surgical site infection. To qualify one wound to be SSI, there are some criteria and at least one of them has to be fulfilled. What are these criteria? Let us see. First, there must be purulent discharge with or without laboratory confirmation from the superficial incision. 2. The organisms that have been isolated from an aseptically obtained culture of fluid or tissue from the superficial incision. 3. At least one of the following signs or symptoms of the inflammation, like temperature, increased temperature, tenderness, localized swelling, redness, or localized increase in temperature must be present. 4th, the diagnosis has been made by the surgeon or attending physician that yes, it is surgical site infection. Now, the incisional site infections, which is a part of surgical site infection, can be further divided into whether it is superficial incision infection or deep incision infection. Now, the superficial incision SSI will involve only the skin and the subcutaneous tissue. But if it goes deep, then it can also involve the deeper tissues like the muscles and the fascia. Now we come to organ space SSI. As the name says, or it involves organs, so infections of the organs or organ spaces explode as a part of surgery is called as organ space infection. Now, a very simple and straight question. What are the methods to prevent SSI? That is our main goal, right? So, prevention of surgical site infections rely on changing or dealing with modifiable risk factors that will predispose you to SSI. 1. We have the pre-operative measures, then we have the intraoperative measures, and third we have the post-operative measures. Under pre-operative measures, 1 is the hair removal at or around the incision site. This should be done immediately before the operation, preferably with the help of electric scissors or depilating agents and not with razors. So first is hair removal pre-operatively. Second, the surgical team members should use chlorhexidine based hand scrub or gel for antisepsis of the hand, forearm before performing the surgery. So surgeons should also be careful. Any member with open infected skin infection should not enter the OT premises. And this is a very important thing because surgeons are only performing surgery, so they have to maintain the aseptic conditions themselves. Third is the proper disinfection of the surgical attire, the scrubs that you wear, the surgical gowns and the gloves. Fourth, asepsis is the pre-operative dressing and draping is very important to minimize SSI. How to do that? It includes the cleaning of the wound with chlorhexidine, iodine-based liquids, and prevention of dead space or potential spaces where fluid accumulation can occur in the post-operative period is instrumental in reducing SSI. Point number E can be antibiotic prophylaxis that depends upon the class of the wound. It is also helpful in preventing SSI. And point F is shorter peri-operative stay is associated with less SSI. Now, what are the intraoperative measures? First, maintaining normothermia And preventing hypothermia reduces the risk of SSI that is caused by triggered vasoconstriction at the surgical site due to hypothermia. And unnecessary traffic inside the operating room must also be avoided. Point number 3, use of supplemental oxygen in the intraoperative and early postoperative period has been found to have an impact on the rate of SSI. It reduces the chances of SSI. Point 4, reducing the need for red blood cell transfusion intraoperatively will decrease SSI. And point 5 is good control of the glycemic status intraoperatively reduces the chances of SSI. Now, what are the operating room measures, that is intraoperatively? First, positive pressure ventilation in the operating room. So as I was saying, positive pressure ventilation in the operating room with respect to the corridors and adjacent areas should be maintained, and a minimum of 15 air changes per hour to be done, of which at least 3 should be fresh air. Now, second thing is cleaning and disinfection of the environmental services. And third, in the operating room, there should be proper sterilization of surgical instruments, and that is needless to say. So this is all about surgical site infections and how you're going to manage this. That is the end of the video. Keep subscribing.